The hospital has an emergency operation plan that we've initiated. The first step for that is actually launching the Incident Command Center. What is an Incident Command Center? We have dedicated an area in the hospital to manage the disaster at a very high level. This manages our response, makes sure that we're appropriately prepared in all areas throughout the hospital, not just the emergency department, but through our primary care offices, through all the different floors, through the intensive care unit, ventilator management. This is sort of the central communication hub that is able to manage the pandemic. This meets on every day, and it meets several times throughout the day so that we are staying updated with the current situation, with state and federal guidelines. We're meeting frequently so that we can disseminate the information from Incident Command to the frontline staff. We also have a community hotline that's been established. This will allow patients to log on through the website, ask specific questions, and get their questions answered as to how to best proceed when they feel that they potentially were exposed to COVID or they have symptoms of COVID-19. We've also established a way for the community to provide donations. The community has been incredibly generous in terms of reaching out to the hospital, asking us how they can help, what we need. There have been several groups that have donated personal protective equipment. All of those donations go through the foundation office, and we are incredibly grateful for all the support the community has given us. We also have EMS outreach. We have been speaking with our EMS partners, and several of us in the hospital are EMS directors. What does that mean? That means that we're the service directors for your town's EMS paramedic service. We have outreach and communication that is going to each one of the towns so that we're providing the most updated information, and so that your frontline providers who pick you up in the ambulance and bring you to the hospital when needed are following the latest guidelines, and that our communication is completely intact.